killing 17,000 chickens. John Hendren, Al Jazeera, Washington.
Well, joining me now from Bethesda, Maryland, is Dr. Anthony Fauci. He's the director of the U.S. National Institutes of Health. Dr. Fauci, thanks for joining us.
Good to be here.
What is the primary danger that this virus poses? The fact that it could kill very quickly, or the fact that it could be transmitted to humans very quickly?
Well, the virus, as it's circulating right now in mostly Southeast Asia, is very difficult to go from chicken to human, and extremely difficult from human to human. Only a couple of clusters. There's only been about 600 infections. The real difficulty is that the mortality is very high, about 60%. So it doesn't have the capability of going easily from one human to another, and that's the reason why it is not a pandemic nor even an epidemic. It's just smoldering there. So scientists have asked a legitimate public health question that's important for scientists to know, that first of all, it is even possible for this virus to be able to adapt itself to easy transmissibility, because the officials in that area of the world are constantly surveying it, trying to find out, is it going to all of a sudden explode? And if it does develop these capabilities, what would it look like? What kind of things should the health officials be looking for? And if it does occur, is the vaccine that we've already developed going to work against it? Are the drugs that we have going to work against it? So there really was a very valid scientific reason to do these experiments. The issue is that sometimes experiments have what we call dual use issues. Namely, the scientific community with a legitimate need to know will work on it and do good for society, but also it could be used by people with nefarious motives. So the advisory committee recommended, didn't mandate, there's no legal way to stop anyone from doing anything. They just recommended that the data be published in what we call a redacted form, that the conclusions are made available to everyone and anybody, but that the actual specifics of the data be only made available to people with a scientific, legitimate public health need to know, so that they could do things for the public good. So it isn't as if the data will not be available. They'll be available only for people who have a legitimate scientific reason to know, as opposed to disseminating it widely to everyone. That was their recommendation.
Right.
What the scientists do and what the journal does, they're trying to decide that right now.
It does raise an ethical question, though, because I suppose this is tantamount to censoring information in a scientific journal.
Well, it's not censoring, because remember, this is a recommendation. There's no legal way to stop anybody from doing anything. So I have heard some inaccurate statements that the federal government is censoring science. This is a recommendation from a committee, an advisory committee that was constituted by the government, recommending that the journals and the investigators don't freely disseminate the information. If they decide to do that, nothing is going to happen to them.
Okay, so we're going to have to leave it there. Thanks for joining us.
Thank you.
A controversial plan to build one of North America's largest immigrant detention centers is being met with stiff opposition.